This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Jim Schaller.
Welcome, good neighbors, to episode number 18 on the Good Neighbor Podcast Estero. Today we have good neighbor Dr. O'Neill from the Bonita Chiropractic Center. Thank you for joining us today.
Thank you for having me.
Yeah, pleasure. Always good to get to know people out here in the community, including yourself. So why don't we just start out by introducing and sharing a little bit about Bonita Chiropractic Center.
So my name is Dr. Ed O'Neill. I actually took over this practice. It's a practice that's been in existence since 1979. It was the first practice in Bonita Springs, Florida. It was founded by Dr. Joseph Bartal, who was a gentleman way ahead in our field. I got to take over for a little over 20 years. Unfortunately, he got injured, blew his wrist out from working on patients, if you can imagine. Wow. And kind of was a win-win for both of us in the sense that timing was right for both of us. He needed me and I needed a mentor. And so it worked out real well. I came to Naples, North Naples, when there was really no Naples or Bonita Springs to speak of in October of 1979. So we've seen a lot of changes. So we've been really fortunate, just not only being part of the community, but been part of the community for a very long time. And I do think this market or this area is much different. It's not like the East Coast where, you go two blocks over and it's a whole different scenario.
Yep.
So I think for us, it's not only being here and growing up here and knowing most everyone, maybe not now because we're getting a lot of influx of different type of people, which is great. But it's real important, I think, like anyone else's reputation. So for us, we've always kind of founded on a family practice, which pretty much does everything. But we've started by helping the community. And it's been very good to us, from being on the board of directors of the Bonita Chamber myself, for being active in the community, raising our children in the community. I can't say enough good things.
That is great. It is about the community. Now you mentioned you came here in 79. Where did you come from originally?
Originally from outside of Philadelphia. My folks followed some family members to the area. At that point, we would thought we were crazy because it was pretty much south of Pine Ridge and maybe north of, I don't even know at this point, Daniels. If you were lucky, you kind of went through North Naples, Bonita Springs, and blinked your eyes and all farmland, I guess, or cattle.
There was a pit stop between Fort Myers and Naples. There was nothing.
100%. And I say, well, maybe my father should have bought a little more land or had a little more vision. Maybe I could be retired. But, I think everything does happen for a reason. But it's amazing seeing how it's changed. I think look at the last 3 years, how it's grown. I mean, I think we've really been put on Broadway. Lifestyle, what I think what we sell down here, from being active in the community, whether it's playing golf, tennis, and now we got the pickleballers coming down.
Yep.
Which the orthopedic gets those first, but the chiropractors are right behind there in the rehab model. But it's sunshine 365 days a year. I remember in the 80s when the drug commercials would come down because we thought we were kind of God's waiting room down here. And they'd say, seasonal dysfunctional depression. I said I had that when I was 7 in about 1975, trying to go to a ball game because it was raining or snowing. But, so I think really the dynamics for us, we really fit into this community because what does everybody want? Longevity and quality of life. And
absolutely. That's
kind of what we represent, I think, in a lot of ways. When you look towards the chiropractic profession, for us too, we kind of diversified somewhat. We in my facility here, we have acupuncturists, massage therapists. We even have the urgent care from Fort Myers Beach. We welcome them because they lost everything. We were blessed enough to own the property, bring them in. We have a little bit of everything, the medical side, the rehab side. So I think we can give more service to the people. And we try to give them quality service, but service too, nowadays with the influx of people, I don't think there's enough people to help everyone out there. People are searching for help. No matter what the specialty is, last year it's 2-3 months to see a specialist. Well, when you're in trouble, no matter what it is, I mean, you don't want to hear that, and you don't want to sit in the emergency room. And there's nothing wrong with the emergency room. We have the best emergency facilities in the world, but you're going to get referred someone anywhere. So we've kind of tried to adapt to the growing community, but also adapt to, we try to treat people like family. I think reputation is all you got. We don't really advertise. This is probably the first time I've done something in a very long time. 25 years ago, you stood in front of Walmart with your spine, and I hope no one made eye contact with me. I was kind of like, hey, nice to see you. Take this. Maybe someday you'll need me. But nowadays, all we have really is our reputation and word of mouth. And so that's kind of what we've been founded on. We not only, and again, going back to the service, I mean, we're a family practice, but if someone gets in a work-related injury, we can help them. If an auto accident, we can help them. We do decompression, which is phenomenal. We have a core group of people that we work at. I mean, I have a neurosurgeon, neurologist, orthopedic, primary. We have all referral sources. And what do people need down here? Whether it's me or you need a painter, you want to get a good referral.
Absolutely.
Kind of your foundation and your philosophy also. So I bring it back to that. And for us, we've grown. It's immense what the people have done for us.
That's great. It's a testament to what you've built, and you've done very well in connecting with the community, and the longevity of what you've done. It's just incredible. Let me ask you this. How did you get into being a chiropractor?
Well, that's a long story, but so my parents were in the insurance business. It's a true story. I'll just shoot straight to it. I went to business school undergrad, came out, and of course they're grooming me to come into the family business. I really didn't like the family. I'm not a sales guy, which particularly the chiropractic profession has always been seen as that. Once you go to the chiropractor, you always go to them. Listen, I'm not here to sell you. You come. If you want to come, you come. You don't want to come, don't come.
Yep.
So for me, I was going to be broke real quick. Growing up in Naples, I graduated with a lot of great guys, and gals. And, you could come in and take the family business if you're going to stay. But we didn't really have anything but service industry. So for me, I started following chiropractic a little bit. I saw the dynamic shift back then. People were exercising. We were looking more to nutrition, more to maybe helping ourselves along a little bit. And it made sense to me. I was a wrestler in high school, so it was about being fit, by cutting weight, by eating right, and what have you. And so I look back at it, and you have to say, well, it seemed like there was kind of a shift. And I looked at the shift, and I started following a couple of docs around in town, and it made sense for me. So then I went to school. I think the second time around, when you're young, and we probably should all listen to our parents the first time around. But when you're young, you want to do what you want to do. And I think the second time around, I was at a different level, more mature, more driven, and wanted to be successful at something. And I think as you go through life, everything happens for a reason. And I think timing for me, going to school, getting out and working for a couple other docs in town, and then coming to this one and finding my place. And not only my place, but maybe I feel very, happy to be where I'm at. And coming through it, sometimes you want to give up, but maybe you go through that to get to where you're at.
Absolutely.
That's kind of how it happened.
So we've all kind of been through, hardships and challenges. Was there one that maybe defined, who you are today, or probably made the person you are?
I just think I always had to work for what I've got. It didn't come easy, whether it was education, whether it was sports or what have you, but I think that makes you a better person. I think that's something we're missing nowadays. I think nowadays everybody's kind of, and not that a bad thing, because we got to treat everyone respectfully, but I mean, I think there has to be a goal in mind, and there has to be an end result. And there's nothing better coming out of a Monday morning when you saw your new patient on Friday and they said, hey, I had sciatic, I can't play golf, I can't lift my grandkid, and boom, I'm 40% better. And I didn't use anything but my hands, maybe some modality, some heat, some ice, some electric, what have you. But I mean, it's a pretty good feeling. And it's even a better feeling is Mr. Jones from the country club sent Mr. Smith. And not only did I help that gentleman, but I also helped the person that sent him, because they had enough respect to give that person my name and number. So I think no matter what you do in life, I think you try to do the right thing. It's not always perfect. I think when you're young, you're dumb a little bit. One of my kids just went to college, and I gave him the same lecture my dad gave me. When my dad gave it to me, I thought he was nuts. And I stood back after I gave him the lecture, and I'm like, man, that makes a lot of sense. I could have been 5 years ahead, but right. It goes in life.
Absolutely.
And I think one of the greatest thing I ever heard in school, not the greatest thing, but you take little tidbits through life. And I remember I'm in second quarter. This is a big deal. I had to borrow money to go to school. My parents paid for the first round. My father was like, I'm not paying for the second round, which I couldn't blame him. We had a little good time there. And, a guy says, well, what if that's your mother laying face down on the table, or your brother, your aunt, or your neighbor? What would you do? What are you going to do for that person? And I think you have to look at that way.
Yep.
And I think nowadays there's so much going on in the world, and there's a lot of negativity. There's a lot of positive, and I think all we can do is help each other.
Absolutely.
I look at, even just to say one other thing, this isn't just about me. I've looked at different social media stuff, including yourself out there, when people throw a name out there and they come in force for us. And I'm plugging you a little bit on this one. I mean, they say as much nice things about me as my staff. And I don't think nowadays you see that, because we're really all stretched. We're having a hard time finding people to work for us. I think it's another huge thing about a practice. My insurance girl's known me over 20 years. My massage therapist has been threatening to retire for 20 years, just retired, and she's in her 70s. So
wow,
a long duration of people. And I think that speaks volumes, because
it does.
You want to do right by yourself, but you want to do right by the patient, but the people around you. I mean, I think that makes the whole experience, because when you talk about pain, you talk about fear and anxiety too. So
that's good. It's being part of the community, not just the people, like you said, the people work for you, but the people you're affecting.
Yeah, I agree. It's a beautiful community too. I mean, people realize it. It's tight knit.
Yep. So, are there any misconceptions, negativity things that people think when they think chiropractors that maybe like to debunk a little bit?
I think no matter what, when I first started, we were kind of like, oh my gosh, you're going to the chiropractor. And I get it. I think some of it was our profession's own fault. I think the biggest thing, at least that I learned from myself, is you stay in your scope of practice and you do what you're supposed to do. And if that's what you do, and if I say this is what we're going to do, that's what I'm supposed to do. And if I can't help you, why can't I send you to the neurologist? Why can't I send you to the neurosurgeon or the primary guy? Or why can't we get an MRI or something of that nature? I'm not above any of that. And I think the most important thing is, if you come to somebody with a problem, and we're never going to be 100%, but why not help that person some way? If you help that person and send them to someone else, they're going to tell people, he helped me. Here's a quick story. I can't even make this up. I'm first in practice. I'm covering for a guy in Fort Myers. True story. I took an x-ray of the gentleman. I'm working for someone, and we're scripted, and you're going, this and that. And the guy was in his 80s. And I got done with it. And I said, you need this amount of care. And he said, Ed, I just want to drive my motorhome across country one time and back. And he was late 80s. And I said, sir, I agree with you. I said, but could you do me one favor? Could you take this x-ray and take it to your physician? Because I see something suspect on it. And I'm new, I'm green, I'm still up learning. And never heard from him again. So about 3 or 4 years go by, maybe 2 or 3 years. We did a health fair here with Dr. Bartal. I was kind of taking over. And in front of me, I'm standing in a room, and we're introducing ourselves, and we were doing cholesterol. We had the gastro guy here. We had a dermatologist here, cholesterol, blood work. We're doing all different things. And this little man, a little lady stood in front of me in tears. And honestly, guys, I can't make this up. And he said, I shook my hand. He saw back then in the newspaper, we had an ad. I saw your picture in the newspaper. And he said, you saved my life. He had an aortic aneurysm in his down low. They had to do emergency surgery. He got his surgery, and he got to drive his motorhome across. You might have had back pain, but what? That's not here nor there. That's not my place. He has to do what's best for him. But it's just not your. I mean,
you cared enough to help him. Yeah, exactly.
Yeah, and that's the other thing is, we're here to help people. Mm-hmm. It's not about this person doing this or that person doing that. I think if you do a good job. And our numbers don't. I mean, we're close to 15,000 new patients, 100% referral. I mean, that just that speaks volumes. And we probably, if we didn't have the last 3 years, would have been well over that. But you dealt your hand. So it is what it is. But I think the biggest thing for us is, it's service. It's trying to help people. And if you do a good job, great things come to you. But great things comes to that person. That person can go play golf, tennis, pickleball, play with their grandkid, hike. Sit at the beach. As simple as that.
Yep.
Fishing. Yep. Let's face it. It's what we're here for. We're here for lifestyle.
Yep.
So that's how
and Southwest Florida, just like the rest of the world, needs more people like yourself. I appreciate what you're doing. Yeah. No, it's wonderful to hear that. It's wonderful to see a person in action and be so well respected within the community as well. If our listeners wanted to get a hold of you, what would be the best way to do so?
I guess our phone number is 239-992-5311, and our website is bonitachiro.com. And both of those, they'll be we'll take care of you. We'll do whatever we need to do. I know a lot of people are pretty antsy nowadays with insurance and all that other things. We'll do our best to verify what we need to do to make you comfortable, so that the experience can be that much better.
Very good. Very good. Well, Dr. O'Neill, a pleasure getting to know you. Thank you for what you do in the community. And if I got back problems, I know where I'm going. Absolutely.
I appreciate that. Nice to meet you. Thank you very much.
You have a great day. Thank you.
You too.
Bye.
Thank you for listening to the Good Neighbor Podcast Estero. To nominate your favorite local businesses to be featured on the show, go to gnpestero.com. That's gnpestero.com. Or call 239-296-2621.